we want to foster inclusivity. We want to foster mentorship and support and really give a space virtually so that it's so accessible for people all over the country to come and learn about ways that they can be competitive in their fields with less stress.
Hello, everyone. This is Dr. Erkeda, and I'm here with another amazing guest, Alexia Childress. I'm just going to give us an opportunity to hear a little bit about yourself from you.
Yeah, thank you so much again, Dr. DeRouen, for having me on the podcast. I'm so grateful to be here. Yeah, so my name's Alexia, but you can call me Lexi. And I just graduated from Arizona State University in the Honors College back in 2022. Thank you so much. And I am currently in the 2024 medical school application cycle. And I'm now also a full-time marketing associate for Med School Coach. So kind of a really cool, unique path for me. You know, I did my 4 years of undergrad and I'm now into my second gap year. Quick PSA for anybody out there, definitely take maybe 1 or 2 gap years. It's been a great decision for me and allowed me to relax after a very busy pre-med process in undergrad and beyond. So yeah, that's me. Outside of all the work and academics and school and applications, I do love to bake and walk my little Cocker Spaniel. She's 9 months old and she's really fun to play with. But yeah.
I love hearing all about that, especially the baking portion. Like, I don't really bake, but I like to cook.
Yeah.
So you got to do to de-stress. And I absolutely agree with you. For all of the listeners out there who may be new, like you probably haven't heard this, but for all of the listeners who have been here for a while, you probably tired of me saying this. Like, I always tell people, if there's absolutely anything you want to do, any career that you want to explore, anything before committing to medical school, do that first. And then if the passion's still there, like, go right ahead. So I've definitely noticed that a lot of my friends and colleagues, like when I went to medical school, who had another career first or took that gap year, definitely had a different perspective and different kind of unique talent and things to bring to the community instead of going straight through. So there's definitely space for everyone to have their own personal journey, but I would also recommend taking a gap year.
Yeah, no, very important. Highly recommend doing so. And more incoming medical students have taken at least 1 gap year. And nowadays, I've heard it can strengthen your application a lot and give you more time to obtain clinical experience and maybe have a job and, save some money before you go to medical school like I'm doing. So yeah, take a gap year.
Absolutely. So you're the co-founder and the CEO of the National Pre-Health Community. Why is community building important in this realm?
That is such a great question. This takes me back to when I co-founded the organization back in 2020. Like a lot of pre-meds, when the COVID-19 pandemic began, a lot of my opportunities were canceled. My research projects were upended, delaying my application for becoming a medical scribe. And we're all kind of type A pre-meds. We want to make sure we do all the opportunities we're passionate about and, make our application as competitive as it can be. So me and my peers were just really stressed about the whole situation. Some of our classes were also going past fail and how that would look. And it was just really stressful. I was actually studying abroad at the time in Switzerland. And while I was there, COVID-19 had come and went from 1 case to 1,000 cases in 1 week. And I was all of a sudden sent home. And while I was there, I was working on a very, prestigious project, going to present at multiple conferences and get my name in a couple of publications. And at the time, I actually was really interested in NPHC programs. So I was just so, upset and distraught that this had happened. And when I came home, I was just really disappointed. And I connected with a few of my fellow pre-meds, one of which is Alejandra. She was the co-founder of the National Pre-Health Community. And we just realized a need for some organization, some event that brings together pre-meds and also pre-health students, pre-PAs, people who go into occupational therapy and physical therapy and any other healthcare specialties, because they're also going through the same thing, together in a space, the virtual space that was heightened by the COVID-19 pandemic, where we can foster inclusivity and hear from really awesome guest speakers in the healthcare space about how the application process is changing what we can do with our time during the pandemic and how things are changing, and also hear about career advice and application tips. And yeah, we did it in 2 months. I got a couple of friends together. We cold called, cold emailed tons of healthcare professionals all over the country. And we had our first annual National Pre-Health Conference, all virtual, with over 1,000 registrants. And we had built this community. We decided to rename it to the National Pre-Health Community so we could host more events that encompass this community focus that we want to build. We want to foster inclusivity. We want to foster mentorship and support, and really give a space virtually so that it's so accessible for people all over the country to come and learn about ways that they can be competitive in their fields with less stress. So yeah, that's our story, and we're continuously growing for years to come.
I love that. And it's crazy, but we all know, we all have our thoughts about the pandemic and everything that's been happening since COVID-19 entered the world.
Yeah.
But there were so many opportunities for community building and reaching out and collaborating with people who you may not have interacted with, because, everything usually is in person and you have your virtual events and all of those kind of popping up. So there was so much opportunity for collaboration and growth and kind of learning from one another. I'm not going to date myself too much, but back in my day when I was in med school and pre-med as well, the only thing we really had was like the student doctor network, like forums. And I know it's still around, but there's room for so much more. And like you said, like having the collaboration not only amongst pre-meds, but people who are pre-dental, physical therapists, and everything like that. Like most of you guys take some of the same classes, like when you're doing that and you're going through similar struggles, although there may be different requirements for entrance exams and things like that. But it's great to kind of build that community and have thousands of people who are also going through what you're going through to kind of bounce ideas with and techniques.
Yeah, thank you so much. It's really fun too. I currently have a team that's grown now to 30 students, and we're from all over the country. I have never seen any of them in person except for a couple here in Arizona. And it's just truly remarkable. Like, I know someone for the past 3 years and I've only seen them shoulders up. But I know all about their life and their pre-med process and their applications and how well they're doing. And it's just very unique. But I will say that's a great positive aspect of the COVID-19 pandemic, one out of, unfortunately many negatives. But yeah.
Absolutely. So you said that you have one conference down, but now you have a pretty big conference coming up. Can you tell the listeners about why they should kind of stop everything after they finish listening to the episode and sign up?
Yeah, thank you. So this will be our 4th National Pre-Health Conference this year. And every year we're just working super hard to just bring you better guest speakers. I mean, all of our guest speakers are phenomenal, but more unique topics that are relevant to the pre-med space. Every year we do run a survey and ask our attendees, what were we missing and what can we do to improve for years to come? And so we have some really cool sessions this year. Some I'd love to highlight. For example, we have like healthcare data analytics, machine learning, and AI. We also have crafting your narrative, tips and strategies for writing a compelling personal statement. What medical schools are really looking for live on the pre-health pod, which is a unique session I'll get to. And becoming an OBGYN with the very infamous YouTuber, Mama Dr. Jones. She's a phenomenal YouTuber, and you should also check her out on YouTube. Those are some of our really cool sessions that I'd love to highlight, but we also have like tons of other ones too coming to you in July. So if you're interested in any of these topics, some of our other topics also include specific career specialties like neurosurgery and oral and maxillofacial surgery. Some really cool guest speakers from those areas are coming to speak about the careers. So yeah, just working so hard every year to just bring you better sessions, and you can register anytime until July 26th to 28th. It's all free, all virtual at our website, www.nationalprehealthconf.org.
That's amazing. And it seems like there's such a breadth of topics that you guys are covering. So there's something for everyone, something going into data analytics. These are things that they don't even really speak about that much in medical school. So you're getting a preview of that as we enter this virtual world of healthcare and technology, and it's only going to grow over time. And then you have people who are famous YouTubers coming to speak who have that that knowledge and that can bring that to you, and you'll have opportunities to network as well. And the great part about it is that it is virtual because you don't have to save money to go and travel and get a hotel and find your professional outfits and all of those types of things. It's kind of like getting all that knowledge at your fingertips for the things that everyone is practically interested in, and that can help them kind of figure out how to boost their applications and move forward.
Yeah. And I'm so glad you brought that up, because for the last couple of years, some of our attendees have asked, are you ever going to move in person? And I've really thought for a while. I've thought about it for a while and spoke with my mentors. And I realized, that kind of goes against our mission of inclusivity and making sure we are accessible to anybody of any background who can't afford to travel to like some other state in the country on the other side of the country. And we're just going to keep using this virtual space and learn how to keep improving it for years to come, and make sure that you guys are still interested in it. And I know Zoom fatigue is a thing, but in my experience these last 4 years, I haven't really seen it yet. And a lot of our students still want to join our events.
Absolutely. Like, I can definitely see how people are craving some in-person events because we've kind of been in the house for 3 years and we've had all of the kind of Zoom fatigue. But in the space of inclusivity and the space of continuous learning, having the accessibility, it's so important. And there are so many different avenues and ways that we're able to connect virtually, which is just getting better and better. Some people may be a little kind of apprehensive as to how they can work in terms of networking or not in person. Do you have any tips for students as to what ways and mechanisms they can do to still interact with one another and maybe the speakers?
Absolutely. So even for me, a lot of our guest speakers are outside of my state. And so what I've done in the past is, if I've seen a guest speaker that I really align with and I'm really interested in meeting, I make sure to be very involved in the chat during their session. I make sure to answer all of their poll questions. And if they offer their email, which most of our guest speakers do at the end of their presentation, shoot them an email and say, hey, I really loved your presentation, and talk a little bit about why. And then if they're in your area, or maybe if they're at your hometown or anywhere nearby, ask them to shadow. I've done that a couple times, a couple speakers in Arizona, and then I've gone to visit family in California and been able to shadow some really awesome healthcare professionals. But if you aren't able to do that, we also have a Discord, and that is one of the best ways you can network with similar pre-health students and gain advice about things that maybe you're unsure about. We offer free resources and opportunities in your area from all over the country, as well as really cool scholarships too. Our Discord is bit.ly/Discord NPHC. And you can join. Make sure to join now or during the conference or after. And that's a great way to continue networking in the space.
I love that. And I love that you mentioned like utilizing your own resources in terms of joining these groups like the Discord and kind of speaking up in the conference. Like sometimes people, like, I have a unique name, but like asking these questions and things and kind of reaching out outside of that is very important, because there are a lot of people coming to these conferences, but the reason that a lot of the speakers are there is because they want you to learn, they want you to thrive, they want you to do well. So most of the times when you reach out to people like on LinkedIn and some of these other resources, people are more than happy to talk about themselves. Yes, they may be busy and may not be able to get back to you immediately, but most of the times they'd love to have a virtual coffee with you and just see what your goals are, give you some tips. Or if they're not available to do it and they know someone better, like say you're speaking to the OBGYN on there, and of course they have the tips for what they're thinking about in OBGYN, but perhaps you're interested in orthopedics. Maybe they can say, oh, I have a colleague who's an orthopedic surgeon. Let me ask him if he'd like to speak to you. And most of the time people are more than happy to take a few minutes out of their day and chat. So it's worth idea to reach out.
Yeah, you make a really good point there. We have 4 conferences and we have over 100 guest speakers of all different specialties all over the country. Mm-hmm. So if you're interested in hearing from these guest speakers in a one-on-one fashion, maybe through a virtual coffee or mentorship, join our community and register for our events, and feel free to email us and we'll connect you.
That's awesome. So you are very well versed in the pre-med process. Like Of course, you've done your prerequisites, and now with the 4 conferences under your belt in the community in which you're kind of organizing and leading, I'm sure you've heard it all. So,
yep.
If there was one thing that you could change about the pre-med process, what would that be? I know that the process is so smooth, so easy, but if there was one thing, what would you do?
That is such a tough question because it is one thing. But I think right now, something relevant to me currently is decreasing the big writing burden and financial burden that comes with secondary essays. And I didn't realize how extensive the secondary essays process is. Every school, I applied to 23 schools, will send me anywhere from 1 to 8 mini essays per school, maybe a little more than that. Some are similar, and I have to write, 23 times 8, like dozens of essays per school. And I understand the importance of it. However, I think it can just cause and lead to burnout for a lot of pre-meds. Personally, I do work full time, and I know also a lot of pre-meds who need to work in order to live in undergrad and can't rely on familial support. So it can be really difficult when something like this is just so extensive. Additionally, I didn't realize that after I had paid for each school, when I submitted my primary, I also have to pay an additional fee per secondary for each school again during secondaries. That's something I think we should change. We should decrease that financial burden, or maybe a lot of the essays in the secondaries are quite similar. For example, there's one question about, how has the COVID-19 pandemic affected you? Instead of adding that question to every single essay and having to rewrite it or re-add it to each essay, why don't we just add that to the primary application? Why don't we survey all of these schools and say, hey, what are the questions you're asking? See if there's a big number that is very similar across all these schools, and just add them to the primary. And if this, needs more time for pre-meds to fill this out, maybe extend that 1 month window to 1 or 2 months for the filling out the primary application. That's one thing. I did also want to talk about and touch on the MCAT a little bit. That's a huge burden for a lot of people. And it was a huge burden for me. The first time I tried to take it, my score just kept going up, and then it went down and down and down, and I couldn't figure out what was going on. And so I took a break and recouped. And then a year later, I came back and studied for the MCAT and worked as hard as I could. And I just think it's a huge, huge task to take on. And I don't think the AAMC provides enough questions for people to adequately prepare for it. We have to rely on third parties for MCAT prep. And I would really love for the AAMC to release more questions. I know it has been a while. I know they just released the practice exam recently, but let's definitely get more questions in their database, at least, several hundred more, because I've done thousands and thousands of questions in my MCAT prep. So yeah, that's another thing. I could talk about this forever. But
We definitely need to work on revamping the process. I definitely agree with you, especially it seems like the 2 big points that you're talking about is making sure that there is kind of equity in the distribution of prep materials for students who are working to showcase their knowledge through the MCAT.
Yeah.
Of course, there are courses and things that people can buy, but that's not equitable for everyone.
No.
So providing access for students to practice is very important. And then also creating less financial burden. People are going to dedicate their entire lives to serving society through medicine once they become physicians. So creating the extra barriers and the costs with the applications and the secondaries and then the medical school cost itself and the cost of is something that we definitely need to address, especially if some of the programs that they are trying to take away will leave people with a lot of debt. So I think on average for medical students, it's over $200,000 or $250,000 that people leave school in debt. I have friends who have left with $600,000, and the salaries of physicians does not equal up to that. So we definitely have to work to allow more people to enter the field and not burden themselves with so much financial debt, especially if it costs a lot of money to even apply before getting it. That's my rant right there.
Yeah, absolutely. It's taken like half of my paycheck. I'm like, oh my gosh. And, racking up credit card debt is not ideal. So it really is a huge burden. And I am out of college and I don't rely on my family anymore to pay for my costs. Yet, in order to receive any financial support from the WMC or something similar for it, I have to report what my family makes. What if my parents, can't give me money for it? Absolutely. So that's just another conversation I think we should be having too.
Absolutely. We need to advocate for more ways to allow adult learning to occur with people having adult finances while they're trying to study for exams without adult paychecks for med school. So that's definitely something that needs to be advocated for, and figuring out different ways in which we can decrease the financial stress.
Absolutely.
So this next question is a question that I love to ask all of my guests, and it's so unique regardless of what specialties they're in or what stage of life they're in, because we all experience needing to utilize the healthcare system. So if there was a magic wand and you could change anything about the U.S. healthcare system, because we know that's perfect too, what is one thing that you would change with that?
When you sent me that question, I was like, oh boy, I really have to sit down and think, because it really is just such an important question. And in addition to lowering the high costs of medical care, something I want to touch on personally is reducing the burden of clinical documentation. Personally, I was a medical scribe for over a year, and I was just amazed how much the doctors relied on me to provide adequate care as a minimum wage worker. And my company that employed us, we were often short-staffed at the hospital. And so often our doctors would go without a scribe, or I would have to be scribing for 2 or 3 doctors at a time. And for those of you who don't know what a medical scribe does, they write a note for their doctor per patient. I write a history, present illness, what did the patient come in and what's their chief complaint, a review of their systems, some of their symptoms that they're having, a physical exam that the doctor shares with me, what are their findings, and then options for diagnoses, and then discharge, and so on. And so it's a huge burden that I relieve of them, but, unfortunately it's not enough. And I went to this session at the Physicians for Change conference by the American Medical Student Association, which was a phenomenal conference, and you guys should totally go to the next one next spring. And when I went there, I visited Dr. Lee's session, Dr. Michelle Lee. She's a physician advisor, actually, for Med School Coach. And she gave a great presentation and specifically touched on, the leading causes of burnout for physicians. And at the top was clinical documentation, charting, and, writing our notes. And I'm just so shocked that, something like that we can fix is just a huge burden for people and is leading to burnout. So, yeah, that's my answer.
I think that's a great point that you bring up. 2 points of view, I will say, is that I think it's phenomenal that you did work as a scribe. For students out there who are looking to enter the medical field, number one, it gives you insight into what you're going to be experiencing for the rest of your career.
Yeah.
But I think number two, more importantly, it gives you more experience outside of shadowing in terms of seeing how you take a history, how you document in order to bill and in order to have all of the key checkpoints that are needed in an appropriate note. So I'm sure once you do get into medical school this time, you'll be ahead of the curve when it gets to time to be your 3rd year and your 4th year and when you get to become an intern, because you already have the skills that is basically what they're teaching you to do during those years. So I definitely commend that. And for anyone who's looking into other opportunities to figure out how to get clinical experience, I would recommend that you look into scribing. I do from a physician point of view, I love that you mentioned that, because when I was practicing in person as a family doctor, a primary care physician, we did not have any scribes.
Wow.
And out of my colleagues that I know, lots of them, like of my close friends that graduated residency and things with, I think only one of us has a scribe. So with that being said, the extra work that is unpaid and after hours is very burdensome. I remember working on the weekends, even though I was primary care Monday through Friday, or working at home or at night till midnight or something doing notes. So it's very important to, one, advocate for the utilization of technology, advocate for having these resources available for you like scribes, as well as advocate for increasing the technology, like you were saying, with AI and all of these things that will come in the future can definitely help decrease some of those documentation burdens. And it's something that, as you guys are entering the field, can definitely look in, can work with different organizations to help increase those things so that when it's time for you to practice, it won't have that burden for you.
Yeah, absolutely. You remind me of actually a memory that I have when I was a medical scribe. I used to work what was called ACE, which was, I guess, called fast track, where I worked for an ER. Patients would come in and we would see lower acuity cases, and I would see them with a nurse practitioner or a PA. And I remember this one shift I had with a P or an MP, and I had written probably over like 30 notes in our 12-hour shift. And I asked her, I noticed she hadn't signed any of them yet. And I was like, when are you going to review these? And she was like, oh, I'll review them, when I get home tonight at 9 p.m., before I go to bed. I'll watch TV or, eat dinner while I'm doing it. And I was like, wow, I would really hate to do that.
Yeah, so that's one thing that people should look into, like once you do get into your third and fourth year, when you're looking to see which specialty you want to enter. These are the questions that you ask the physicians that you're shadowing and working with, like, what is your work-life balance like what is your home like? And I'm definitely a proponent for family medicine, but figuring out these techniques even now, like how to become more efficient, so that if you do choose to go down a path where there's traditionally more paperwork and prior authorizations and things like that, how can you leave work at work and figure that out? And whether or not that's using dot phrases, advocating for yourself to have a scribe, or figuring out other jobs that may be for you. Like if you do go into primary care, do you only want to work in urgent care, where typically you do write your notes at work? Or do you want to do telehealth? Or do you want to work 3 days a week, or have a schedule where it's half days implemented for documentation? So those are a lot of things for those who are listening who may be considering your field at this point, about to apply to residency, or starting your clinical rotations, where you're thinking about, okay, what comes next?
Yeah. Oh my gosh, what a great conversation.
Yes, it was awesome. And I definitely think you're going to be a friend of the show. We know you're working with Med Coach, medical coach. So whenever you want to come back, you're more than welcome for us to talk about topics of what's going on in the pre-med world.
Yeah. Oh my gosh, I'm so happy to. Thank you again for having me. This was so fun.
Absolutely. So I'm going to give you an opportunity to say goodbye and let the listeners know once again how they can sign up for the conference, where they can sign up for the Discord, and we'll put all of that in the show notes.
Yeah, thank you so much. So first off, register for the National Pre-Health Conference, Broaden Your Horizons, our 4th conference this July, 26th to the 28th. It's all free, all virtual. And even if you can't attend all 3 days or any of the sessions because you might be working or busy like me, we have our recordings posted on YouTube. Just make sure to register to have access to them. You can find registration at our website, www.nationalprehealthconf.org, or tinyurl.com/NPHC 2023. If you want to join our Discord, that link is bit.ly.com/Discord NPHC. And we actually also have a podcast that we just launched a couple weeks ago called the Pre-Health Pod. I host it with my friend Sarah, who's a pre-PA, and she's also been working on the national pre-health community since 2021 on social media. And we both host it every Monday with new episodes. A lot of our past guest speakers are on it, as well as new guests. And we hope to bring application tips, demystify the process, and bring information right to your ears through our podcast. So you can check that out at our website too at www.nationalprehealthconf.org/podcast. And it's also on most podcast platforms as well, like Spotify. And yeah, register today. Secure your spot. Spots are super limited for our conference. So check that out.
I love to hear it. So for all of the listeners out there, once you sign off on this podcast, go and sign up, tell all your friends, share the words. Like, everyone needs to build community. And I think that this is a great opportunity for you to learn what opportunities are out there and what types of things that you can do in order to help your application as you move forward to the next phase in your medical journey. And for all of those other listeners out there, if you haven't clicked subscribe, click that subscribe button, leave us some comments, go on our Instagram and let us know if there's any particular topic or specific guest that you want us to interview. You can go to Med School Coach's Instagram at Med School Coach, or you can reach out to me on my Instagram at Dr. DOCTOR, the letter D, GRAM, Dr. D Graham. And I'll see you again next week with another fantastic guest. Bye!
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward med school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.